So the purpose of this meeting is to share information about encumbrances and expenditures, contracts that have been awarded, changing needs in the community, and projections of future need, and engage the public in a debate about how future coronavirus aid, relief, and economic security CARES Act grant money is spent. Diane, would you please call the roll?
Yes, ma'am. Excuse me. Councilmember Dunaway.
Present.
Councilmember Days.
Here.
Councilmember Gray.
Brett.
Madam Chair, you have a quorum. Madam Chair, you have a quorum.
Great, thanks so much.
There you are.
The committee takes official notice of and admits into evidence all St. Louis County ordinances and resolutions. Good afternoon, everyone. Thank you so much for being here. It has been a while since we last met. These past several weeks have forced a shift of all hands on deck back to our original public health crisis that continues to worsen in St. Louis County. That being said, we are long overdue for an oversight meeting and an update from the CARES team, and I sincerely apologize, not only for my part in the delay, but in having to move the time and day of the meeting to accommodate my schedule. So I appreciate the flexibility here. Our format will follow the usual course with updates and opportunities for questions in each of the core areas of the County CARES program, beginning with public health, then humanitarian, and we will wrap with an economic rescue update. What's going to be done this week is that we are going to be hearing from those leading on the front lines as opposed to through the county executive's office. Though Paul Kreidler is here, I believe, I hope, if there are any budget concerns to address. We've also got Dee Vinker and Cora Faith Walker on the line from the county executive's leadership team. Should you have questions that are best, I see Paul now, best answered by them. But before I hand it over to Spring, I just want to make sure I see her too. Is Spring here for the, yes, okay, I see you. Before I hand it over to Spring, I wanted to let you know that Spring is going to be doing the update for public health. Then we're going to hear from Emily and AJ maybe to catch us up on what's going on in the County CARES humanitarian efforts. And finally, I think Rodney, Vita, and Rick were invited to catch us up on what's happening on the economic rescue front. And with that, Spring, if you are ready, I'm going to hand the floor to you.
So can someone queue up the PowerPoint presentation, please? Thank you. Okay, if we could move forward through. I hope everyone remembers that our mission was threefold in this CARES activity, but we can move forward to the current numbers. And so this is where we were as of Friday. We have added a significant number of cases since then. We are currently today at 46,954 cases in St. Louis County. We have seen a slight slowing of the cases in the last couple of days, but we also know that there have been some significant testing delays at several sites across the county. St. Louis County's sites, however, are currently well stocked with testing supplies. But because of the volume of people that are out there currently seeking testing, we are getting reports that urgent cares and some other community sites are experiencing some delays. So we currently have just under 47,000 total cases in St. Louis County. And we do continue to see extremely high hospitalization numbers, as well as the people that are currently being monitored in isolation and contacts for quarantine. So if you could advance the slides, please. We'll move forward with several of the updates. Some of the things that you may see is that we have currently replaced our drive-up testing tent. We were planning to do this anyway. The current testing tents that we had were actually, they're quite small, and they were, one is located at South County and one at North Central, or not North Central, but at John C. Murphy. and we had another set that we were traveling with at various locations. But as we moved into the winter weather, we wanted to make sure that we kept this drive up going, and we wanted to have a sturdier tent. The tents have been blown down multiple times in the most recent storms that we had about a week and a half ago. The tent at John C. Murphy in particular was destroyed again. So we had already ordered these additional tents, but we're excited to see those come in because they will actually offer the staff more comfort so that we can continue to do this through the winter. And they have a tent arch piece that people can drive under so that when they are rolling their windows down, Chris, I can see your email.
Oh, sorry. Hold on.
Okay. When people are driving through and they roll their windows down to receive their swab, they are also protected from any weather that will go. So it will allow us to make sure that we can operate the testing site in the more extreme weather that we're expecting over the winter for both the staff's comfort as well as the people who are driving up. So that'll be great. Test kits and lab services. We do still continue to have lab service contracts for right now. But we are moving and transitioning most of this testing to be able to run our own laboratory services. We've talked about this a little bit, but that we've received some funding from the state, and we are also contributing to that to make sure that St. Louis County will always be able to run its own laboratory tests and keep that moving forward. We are buying some additional saliva tests from Washington University, and we are buying some additional tests on our current contracts to make sure that in any testing scenario that we see through this winter and well into next year, that St. Louis County is able to maintain a good, solid testing supply, as well as the ability to run tests on our own so that we can manage, I think, fiscally through the 2021 year and not be sort of as dependent on some of these external lab contracts. So the test kits and lab service continues to be one of the most significant purchases that we use. And we're really aggressively pursuing that through the end of the year with this CARES funding. And the grant funds to build out our lab is really a big significant piece of our long-term strategy moving forward. So we also, on the access to care section, we have been working for quite some time with many of our partners that we have funded to increase access to care in our community. Those funded partners are beginning to submit invoices and reports, and we're making sure that they are doing that. We're doing all the monitoring ourselves here in DPH to make sure that they comport with all of the federal guidelines that we've been given. So that we can make sure that all of that funding is dispersed and documented appropriately for the CARES funding. So our relationship with community health centers is also still a priority with the department to keep their testing programs moving forward. We do also provide them with PPE occasionally to make sure that the staff that are out there doing some of the community testing at the health centers are all moving forward. So we hope to have a report for you soon as those reports come in from each of those funded agencies so that you can see some of the service provision that has taken place. But the reporting functions is dependent on the invoicing. We're moving through all of those processes right now. And then I think the next piece is the prevalence investigation. So if you saw the announcement this morning, this is actually started a long time ago from council money before a council appropriation request, before we actually had any funding from the CARES, but we did not have any of the RFP or anything launched by the time the CARES was put together. So we were able to utilize CARES funds for this and launch this investigation into the actual prevalence of what is taking place in our community. So those results do show that while we have had a large number of people in the county who have had COVID, it is not as many as will have not yet had it. So we currently are estimating that it is potentially about 50,000 people to 70,000 people at most through mid-October who had COVID at some point over this time. And the number of people who are currently prevalent from our current case results may be more than 3 times that. But that does still mean that there are a lot of residents in St. Louis County who have not had COVID. And that means that they are still quite susceptible to getting it. So many people talk about strategies like, herd immunity or many of these other things. Unfortunately, St. Louis County is a very long way away from that. And there are a lot of people who could potentially catch COVID before there would be something like that was available. So there are a lot of people in our community that have had COVID or currently have it, and there are an even greater number of people who are still at risk for COVID. We did also identify through that survey several pieces that showed that further emphasize some of the disparities that we have seen, that a similar portion of male and females had COVID, but that our African-American residents in St. Louis County had more than twice the rate of COVID as those that are white or Caucasian in our community. And that just further emphasizes the disparities that we have seen. And this is why we have focused on the equity strategy, both for the disbursement of access to care funds, as well as testing locations and the other services that we have provided through the public health dollars. So we do continue to move through those. Community masks is another topic. We do spend a significant amount of CARES dollars on PPE. We do also have provided some updates on the school PPE grant. DPH has now distributed over 3.2 million masks to 42 zip codes in St. Louis County. We have been pushing that out for quite some time now. We also did distribute $2.3 million to the school districts to make sure that they could also get some state funding, but cover costs that they have for providing PPE within their school districts as well. And so St. Louis County was really happy to be able to provide that matching amount of funds for those. Staff are also currently distributing larger PPE kits. They've handed out 362, predominantly or actually all entirely at this point in North County. And some school districts are partnering with us on amplifying where there may be some additional need in some of those areas too. So those kits have PPE as well as other cleaning products, hand sanitizers, antibacterial wipes, many of those other things, masks to help people keep safe in their community. So I think those are some of the biggest updates that I have for each of those large bucket areas. Does anyone have any questions for me?
Any questions from Councilwoman Gray or Days?
Yes.
Councilwoman Days.
Madam Chair, may I ask a question?
Yes.
Okay. Spring, I want to go over a couple of things. First of all, in your access to care, is this access to care simply for COVID?
No, we had funds for mental health. We had funds for primary care. We had some additional funds for substance use care. It was a broader access and connectivity to the wide variety of care that people may need right now.
The reason I ask that is because early on in this process, we were to get some kind of plan from you regarding how we are dealing with the vulnerable communities of which I represent, and how we're going to address the comorbidity issues that happened there. And we were supposed to get some kind of a plan as to how we were going to address that. Do we have that yet?
That is the plan that we submitted as part of the way that we rolled out the community funded grant money for the $7 million that we supplied in this area. And then we provided some updates on each of those organizations that did receive that funding and who they were and who each of their target audiences were.
So I know that you mentioned part of it would be primary care. So do we have any numbers as to how, and with this plan that you have, what have been some of the results in the implementation of this plan?
So we are still waiting for the reporting to come in from each of those community partners. We did a first up distribution of their funding, and then we are working with them on making sure their reporting can comply with the federal standards. So we have a few of them in, but we don't have everybody in, so it is incomplete so far. But yes.
So when can we expect that?
So I am hoping that we will have that information within the next couple of weeks. But we will certainly be collecting all of that, and they'll be continuing to provide services through the end of the year. So we will continue to have more services that go right up until like the end of their contract periods.
All the contract periods ending December 30th?
Yes.
Okay, let's move to contact tracing. I understand from the media that that program has been ended. Is that correct?
So there is still some small amounts that we are able to do, but we have transferred all the contact tracers to be case investigators. We do still do contact tracing for some of our special needs groups. Particularly, we're still working with schools as well as some of the long-term care facilities and a few other businesses where there's high need. But we cannot currently staff the number of people that we would need to manage the current volume.
Well, I really was interested in how did you come to the conclusion that, you know, the restaurants or that industry was, I guess, basically responsible for, I guess, the additional spread, if you will, to some extent, because we did have some issues with the restaurant industry. And so I was, without the contact tracing, how do you make those determinations?
So it is the case investigation process that predominantly identifies that piece, and we do still do that. However, it is more about not specific to the restaurant industry, but the opportunities that take place across the county where people are unmasked in indoor rooms, and those are all of the areas that we targeted. It wasn't specific to, we looked for where people were gathering with no masks in indoor facilities. So that is also shut down in entertainment industries. It's also shut down in gatherings and events and everywhere else. It isn't specific.
So was the casinos closed as well?
They have to shut down their food and drink services.
Well, but not the other part. So sorry.
Everything is shut where people have to be unmasked in order to participate. So if there are services that can be held where people can wear their masks indoors the entire time, those have to submit plans for review. It's about being able to wear a mask in an indoor facility the entire time.
Okay, and the last question probably for you is going to have to deal with the vaccine. Where are we with that? Are we going to be able to get the vaccine? Who will be eligible for the vaccine? That kind of information. Do you have any information on that?
So the federal government, as well as the state, are organizing the primary plans. We do not have a ton of information yet, except we are participating in all of the regional planning processes for how that will be distributed. We do work with partners on the plans, but we have not been given any dates and when we will have vaccine available or provided to us at this time. And that information will be organized by the state. The who will get it is currently being organized and dictated by the federal government. We do not anticipate that we will have community level vaccines available until at best the spring of 2021.
That's it. Oh, one other thing. You indicated that you would be you would have continued testing. I guess that would be past December 30th. Did I understand that correctly?
That is correct.
So that means that you have, I guess, put back a lot of the testing so that you will have the availability for that?
We have overbought in some testing so that we could continue to use it into 2021. We cannot buy services from other people past December 30th, but we were given permission to buy materials that we could utilize in 2021. So okay. That is why we're making sure that we're set up to be able to run that ourselves, because I won't be able to afford laboratory services in 2021, but we will be able to continue to run DPH's testing sites.
So if you going to be continuing testing? How much of a stockpile do you have? How long do you think that will last?
So it will very much depend on volume, and I very much hope that the volume goes down. But we are trying to last as far into 2021 as possible. So that is our goal, is to be able to continue to make sure that especially if other groups are unstable, people may consume our services even more than they do now. But we need to be able to make sure that there is testing available. So we are trying to provide as much as possible to make sure that we have it for corrections for the entire year, so that we don't run out, because it is not available on our 2021 DPH budget.
That was my question. So you don't have anything encumbered in your budget for COVID-19 services or materials?
I do. For 2021, there are some, but it is not at the volume that we are currently providing. So I do not want to have to restrict our services in 2021 for testing. So we are pre-buying as much material as we can. But 2021 budget will cover the staffing to keep those services up and running. And it will also cover some additional materials if we start to run out. But we will also aggressively seek some external funding next year too, if we have to.
Thank you. Thank you, Madam Chair.
You're welcome. Councilwoman Gray, Councilman Tracus, I want to check in with Councilwoman Gray first.
Okay, thank you.
You're on mute.
No questions.
All right, great. Councilman Tracus, the floor is yours.
Thank you. Good morning, Spring rather.
Good morning.
Couple of questions. Your mask order for all services indoors, does it provide for any type of accommodation for people with disabilities
Yes.
regarding wearing masks?
Yes, it does.
And so explain for us what that individual might have to do to make sure that the accommodation is honored, or the facility for that matter.
So if someone says that they have any health condition, and they shouldn't have to necessarily explain it to anyone, that it forgoes them wearing a mask, that should be honored by any organization or institution. And if we get someone who complains that they feel like they have been, so that's been misrepresented by an organization or a business in St. Louis County, we do call them and make sure that they are educated about what their responsibility is to accommodate someone who has a health need.
I'm sorry for interrupting Councilman Tracus and Spring, but I have just been advised that this meeting was noticed as CARES Act and not the mask orders. So we need to stick to the CARES Act. The CARES Act.
All righty then. So does that mean then that because it involves the CARES Act, there can be no questions with respect to orders issued pursuant to the CARES Act?
It's only about the grant, the CARES Act grant money and how it's spent and to be spent.
Well, okay, that's fine, and I will respect that advice. But with all due respect, it seems to me that Councilwoman Day's question certainly bled out into the order of the mandates before the admonition was issued, no doubt, by the county councilor's office. So I'll save my questions for another day.
Sorry. Are there questions from any other council members? And I can't see you all, so you're going to have to shout out. Okay, I'm not hearing any questions. So thank you, Spring, very much. We appreciate the update. And Emily, I saw you. I don't know if AJ's here with you, but you are next for the humanitarian update.
Great, thank you. Good afternoon. Thanks, Chris. So I have a few updates within the humanitarian bucket. Namely, right now, I will echo Spring's comments that we're really focused on reviewing reports and financial documentation in alignment with the proposal by the humanitarian grantees and the federal guidance. So both CSF and DHS staff are managing that internally, both reviewing financial documentation and then the reporting. So we'll also in alignment, we'll have a report on services provided, clients served, all of that information in the near future. We ask that humanitarian grantees submit 2 reports, a midterm report, which was due on November 13th. So again, our staff are analyzing those reports. And then the final report is due on January 15th. Grantees have until December 30th to expend funds and provide services to the community. Chris? So one important update in working in collaboration with our partners, both in the philanthropic and service providers through the regional response team, identified the emergent need for additional food distribution. Food insecurity continues to be a priority in the region. And so we were able to provide additional funding to Operation Food Search and St. Louis Area Food Bank. And then we also were able to provide some funding to 2 new partners, the NAACP of St. Louis County and HOSCO. HOSCO is focused on providing food to seniors and homebound, and then NAACP will be providing food, namely in 2 sites in North County over the coming weeks. Chris. Oh, this is Yusuf. Are you on the line? I think Yusuf will be providing the housing and utility update for the Department of Human Services.
Great. Thanks so much, Yusuf. Welcome.
Thank you. Thank you, Chairman Dunaway. Thank you, Oversight Committee, for the opportunity to speak to you all about a very important element of the humanitarian effort, that being the housing and utility response. We have a tremendous amount of need that is being expressed at this time. The resources that were afforded under the CARES Act were never, I believe, thought to be necessary to the extent of the longevity of this pandemic. And we're certainly doing all we can to respond to the expression of concerns during this time. We have awarded 23 organizations contracts to provide housing and utility assistance. That also includes mediation to try to remedy and work out certain situations so that folks can remain in their housing. We have to date just a little north of 4,700 applicants. And I want to backtrack just a little bit. We made sure that we tailored these resources in 2 ways. One is to ensure that we were addressing the most in need, and that was based on not only a zip code alignment to some degree, it also was based upon income guidelines. And so it was no more than 80% of AMI. So if we compared this 4,700 number to one of our other area entities that are also doing this sort of service in the city of St. Louis, they have over 10,000 applications. But that's also because they have a higher income guideline for their resources. Even with that being said, the majority have been assigned to organizations. So for those who are not aware, we are utilizing the Unite Us platform, which is operated through the United Way, for the coordination of these activities. Imagine standing all of these resources up without some sort of centralized database for collection of such data and to ensure that there's no duplication of services and effort. So the Unite Us platform was stood up to assist us in that effort. To date, essentially a little south of 3,900 have been assigned to organizations. And of those, a little north of 2,200 households have been accepted by funded organizations to be assisted. Next slide. That has led to, as of Friday, end of day on Friday, a little bit more than $1.9 million has been reported in the system. That is for approximately 12 of the 23 organizations. So there are still 11 organizations that have not input data into United's platform. There, I think, are some staffing capacity concerns about entering that as they're working through, again, thousands of applicants. Yet, as Emily mentioned earlier, there is a November report in which we'll be evaluating much of the uploaded information that will allow us to gather more for a future report. Average household assistance is about $1,850. Imagine there has been approximately 7 or 8 months or more of hardship being experienced by many households. And so we have seen this amount go up as people continue to experience hardship. And again, as I mentioned before, the reporting of information will become more robust. The information that is entered into the United's platform is centered around direct financial assistance. It does not account for some of the funds that were awarded that allow for staffing associated with mediation, case management, and engagement of those households in order to work out plans to sustain their households. That is the report at this time.
Does anyone have any questions for Yusuf or Emily?
Yes,
So
I
far.
do.
Yes, Councilwoman Days.
Thank you.
I have a couple more slides. I don't know if,
Oh, that might,
yeah.
I'll wait, Emily. Thank you.
Sorry, I don't want to interrupt, but yeah, we can finish ours, and I have more slides.
I jumped the gun. I thought you were done.
No, that's okay. It was just the order of things, so I apologize for that. So wanted to give you a quick update on the technology, our digital equity initiative. The St. Louis County Library was able to secure 2 additional orders of Chromebooks of 6,000. So it brings our total from 2,500 to 6,015. And as of the beginning of November, they have distributed all hotspots and all Chromebooks. So distribution took place the first and second week of November. And as you can see articulated here, the number of schools and districts impacted. Just as a reminder, the school districts work to identify the students who would benefit from this technology. So they have been distributed. They may still be, working through some technology distribution to the eligible students, but that's great news. And we were able to fulfill half of the need identified by the school districts through county CARES dollars. And then my final slide. A quick update on the Child Care Relief Program. You've seen this spreadsheet presented. As of last week, we're about 94% checks in process or issue. We had a few lingering issues with some of the grantees. We worked and had to do a little bit more due diligence on, we had some requests from school districts, and so we wanted to make sure that our funding didn't overlap with other CARES funding. So you'll see, some of those under review. Others had to, execute contract amendments, or some hadn't signed their contracts as of last week. And so we're nearly complete with the Child Care Relief Program. All child cares received their full funding up front. And as we know, they probably incurred those business interruption and PPE costs ahead of time. And so they will be reporting their documentation to support those expenditures as well. And with that, I conclude my portion of the presentation.
Thank you, Emily and Yusuf. All right, Councilwoman Days, the floor is yours.
Right. Emily, how much money did you have for your child care bucket, if you will? What was your total amount of money that you had?
Yes. Yeah, so originally we had allocated $5.9 million. And that was under the assumption that every childcare in St. Louis County would apply for funding under the formula that we had presented. So when the program closed 6 weeks after its completion, we had received 108 applications and totaling about $1.9 million.
So you had 5.9, you spent 1.8. Is that right? Did I see the right? Yeah, 1.8 is the total that you have spent.
That's correct.
Okay, and what is going on with the rest of the money?
So that money was reallocated to food distribution. We identified continuing need in the community as the pandemic continues to rage on in our community. And so that was redistributed to food distribution.
Well, the facilities in my district have indicated that even though they had received that and they knew from the beginning that all these people would not be applying, why would you not redistribute that within the bucket that it was already allocated for? Because none of that money really took care of all of the needs that they needed. And so that would have been a consideration, if you will, to do that, so that you're just not a little bit here, a little bit there, but you put them all together, and then you can make the case, for them being made whole, if you will. And now that we have a second round of infections coming, how did that play into that decision?
So again, I think we made the best decision at the time relative to childcare. And, we did extensive outreach to the childcare community. We provided a contract to 2 entities to provide technical assistance. And we did not get the number of applications that we had anticipated getting, and that program opened and closed. And given the time frame of trying to get money into the community before the end of December, we and in working with other collaborators, we determined that it was in the best interest to provide that funding through food distribution.
The information that I've received from many of the child care centers, as with the small business, that it was cumbersome. The paperwork was extensive, and there was not a lot of technical assistance giving there. They also equated this to the city of St. Louis and how they distributed their money. They did not have nearly the kinds of to jump through the kinds of hoops that in St. Louis City that you have to jump through out here in St. Louis County. So that's kind of interesting to me. I want to go to your food insecurities that you talked about in that Yusef. Sure. But did we have any delivery services in there? Most of the ones that I saw, you drove in your car and you picked up your food. However, if you're a senior or you're disabled or anything like that, you were not able to do that. Did we have any kind of delivery services associated with this?
I will have to go back to the HOSCO application. I know that is specifically targeted to seniors and homebound. So I'm assuming, and I don't want to assume, but I will have to get that information back to you.
And of course, HOSCO just came online along with NAACP. They just came online with their program. Is that correct?
Yeah, those were identified by our community partners and other funders in the region as options for food distribution.
Do you have any encumbrances in your budget, the budget that you're utilizing here, moving forward?
No, all of our funding ends at the end of December.
You have nothing you're putting back to save, because I'm curious as to how you're going to continue moving forward, or even if you plan to continue to move forward with some of these services.
So per the coronavirus relief fund with which these funds came to St. Louis County, all expenses must be incurred by the end of December 30th, 2020. So we're all sort of faced with that deadline in terms of services.
Well, the senior citizens are really concerned about that, and I guess we'll get to the IT part of this because we had some money that I don't know. Did you administer this program as well?
We did. So through the humanitarian effort, we had a number of senior organizations who applied for funding specifically for technology. I provided that list through the county executive's office, and we can resend that. There were about 12 of them. The Jewish Federation of St. Louis is leading the collaborative of 5 senior organizations to distribute technology and training for seniors and other homebound individuals. And so that they can be connected both to health applications to manage their health, as well as address social isolation. So there were about 12 organizations that received funding through the Humanitarian Relief Fund.
The last information that I received was that they did not do that, and I don't remember the lady's name who was over the seniors. Anyway, she sent an email saying that was just not sufficient, or it was not being handled as we thought it would have been handled. So I think it's important that we double circle back around and figure out if actually that is happening. My guess is it's not, but nonetheless. I want to go. Let me go to the people in need in terms of the housing. And you indicate, I guess Yusuf indicated that there were income guidelines. And when will we have a report on how much was spent in each of these areas? Looking at the housing insecurities is what I was talking about.
Yeah. What is your, Councilwoman Days? What's your specific question? We certainly.
When we get a report on the housing insecurities and how that. Okay. When will we get a report on the housing insecurities based on the income guidelines that you mentioned? You may not necessarily meet the guidelines today, but with your job going away, you may have a need later on. And how are we addressing that? And the first part was about a report on who received that and what were the outcomes of that. We're looking at December 30th, around the corner. And so we're looking at that issue.
Sure. So data collection pursuant to those who receive these resources are not only disaggregated based upon zip code, but also income guidelines. So just to give a little context, 80% of area median income is the maximum that is allowable for the utilization of these resources. That allows for a single person making approximately $46,000 a year to be eligible. And then based upon household size, there are different income guidelines associated with that.
Housing, right. Mm-hmm.
Right. And so we have the data. We'll provide the data around where that money went, et cetera, and to what extent that benefited those households. Our goal is to ensure that no one loses their resources. And so that's why we have a wide variety of players that are at the table, both from an organizational standpoint, that are not just providing financial assistance, but are also connecting folks to other resources. So when we get and we sift through a bunch of the data that has not only been provided, but also that was submitted with the November 13th report, then we'll be able to provide more for you.
Okay, thank you. One last question, Emily, for you. You indicated that all the hotspots and all the Chromebooks had been distributed. Were they distributed on what the need was or what you had?
So each school district submitted an application to the St. Louis County Library based upon their identified needs. So again, they defined the need within their own community. rather than the St. Louis County Library defining the need based upon the region. So those were identified probably in a number of different ways through social workers or student support service or guidance counselors, the homeless prevention or the homeless coordinators. So, it was individualized to each school district based upon their understanding of need within their community.
So my question was, if they needed 10 and you only had 5, so you're saying that you had distributed all that you had. And my question was, they needed 10. Did they get 10?
Not necessarily. Again, we met the entire need for hotspots. So we had allocated originally 10,000 hotspots, and there was only a request for 9,878. So we were able to meet the entire need for hotspots. And then we had originally allocated 2,500 Chromebooks, but saw the overwhelming need and requests from the communities for 12,000. So did a couple of additional orders and were able to fulfill 50% of that. So understanding that there's philanthropic, private, and other state funding for many of these resources, we allocated as much as we could through the CARES Act, understanding that there are additional funds in the community.
So everyone did get a report of a major discrepancy in those in the need there and the request from the school district. So that's why I continue to ask that question. You gave out what you had, not necessarily that did not necessarily fulfill the need that they had, but you distributed what you had. I just want to make sure I'm understanding that. That's correct?
That is correct, and we can provide that report to you as well with numbers.
Well, hopefully, with the December 30th dateline looming, we'll have a complete audit of all of this stuff. So thank you so kindly. I appreciate that, Madam Chair.
Thank you, Councilwoman.
If I might add one piece to Councilwoman Day's her question about continuity of service and what things look like in 2021 relative to budget set-asides. Just part of the reason why the income guidelines were set as such was not only just to target those who were most in need, but it was also to ensure that those who are in the pipeline can still receive assistance through some of our other resources come January 1st of 2021. And so we currently have an RFP that is out to do just that, so that folks do have a resource to lean on. And those who have been vetted aren't just left in the wind when it comes next year.
You are aware of the Project Homeless Connect, so these issues aren't new. I just wanted to make sure that this COVID has exacerbated those, and so that we want to make sure that whatever we do and whatever we can do, moving forward, we're in a position to do that. So I appreciate that. Thank you so much.
You too.
Are there questions from any other committee members?
Madam Chair, if I may, this isn't a question so much as a comment. I appreciate Councilwoman Days' questions. I think a lot of these questions have to do with our 2021 budget, which is not the topic of this meeting today, so I don't intend to get in on that or to dive into that further, but I just invite the rest of the council members to think about again, how Councilwoman Days has said that COVID has exacerbated many of the needs that already exist in our community, and then think about how we can use our budget in 2021 as a tool to help meet some of those needs. So I just, it's sort of a parking lot comment, but that's something that needs to be at the top of all of our minds.
Thank you, Madam Chair. Are there any other questions from council members?
I have a quick question. I've gotten several calls, texts, emails about Riverview Gardens not having access to Chromebooks. This isn't a question that needs to be answered right now, but if Ms. Koenig or someone can get back with me about that, I'd appreciate it. I don't see her.
I'm right. I'm still here. Oh, thanks, Chris. Yes, I will get back with you on that. Let me open up the spreadsheet real quick. It may not be the right one, but I can tell you how many they received from us.
I mean, since this is a question that's pretty much specific to North County or my district, you can answer me later.
Yeah, so they got 1,300 Chromebooks. But I will get back to you because this spreadsheet isn't showing what they requested, so I will make sure.
National site that still won't help me. Okay, well, let me know. I appreciate it.
Yeah.
In fact, I just got a call today right before the meeting.
Right, and I understand that the philanthropic community and the private funders continue to talk about meeting the technology needs of students.
Thank you.
Thank you. Any other questions from the council? All right, great. Thank you, Yusuf, and thank you, Emily, for your humanitarian update. We really appreciate it. And I think we're ready to pass the torch to Rodney with his economic recovery update.
Yeah, good afternoon. I don't think Rick could make it today. I think he had a conflict, but I will try to walk through the economic recovery components here, and this just provides the overall. And then if you hit the next one, okay, so this provides a summary over the last couple of months. About 1,600 checks have gone out to businesses in the St. Louis County, totaling about $19.5 million. And they're in the process of doing some of their follow-up paperwork on those. As you recall, the county executive established the Economic Rescue Team, and that team, with its steering committee led by Rick Stevens, as well as the working groups, which involved a number of volunteers, have come up with a number of recommendations that will help with this relief and recovery. And so a number of those ideas and recommendations, as the previous conversation talked about, was helping also set us up for 2021. And so we're doing some things that we have to do right away here to use the remaining funding in 2020 by December 30. But then we've also have the structure now and processes to be able to expeditiously get money out in 2021, should that become available, which we hope it does, from the federal government. So you can hit the next slide, please. And so one of those ideas from the Economic Rescue Team, from the working groups, was to establish a small business rapid deployment fund. And that's using some dollars that were remaining from the original county CARES money, which is approximately $3 million. And so the partnership has been working very hard over the last week, a little bit over a week, with the various county departments to come up with a program that's more straightforward to administer, as well as get the money out quickly, hence the name Rapid Deployment. We only have about 4 to 5 weeks before December 30th, and so we had to be able to move very fast. And so we announced last week that this program would begin today. This is Monday, November 23rd at 9 o'clock. It did start this morning at 9 o'clock. We have plenty of emails to our website, as well as phone calls to our hotline, which is 615-1777. And then we've been fielding other calls. We also sent out notification of this in advance to the Restaurant Association, to all the chambers that we are aware of. We asked them to pass it on. All of you council members received a personal note from me to forward that out to your various organizations and businesses that you are aware of, and so that we could, again, meet our objective of helping these small businesses and restaurants with these $5,000 grants. They have to show expenses between April 1, 2020 and December 16, 2020. As you recall, in my previous comment, for the small business relief program, that $19.5 million that just went out in the last few months, those companies and restaurants and businesses are working with complying with the receipt of those monies. And so these monies are for additional businesses, not the same businesses. And we had to do that because of the shortness of time and the focus on getting all of this out before December 30th. All right, and then the next slide. This gives you an idea of the eligibility. This was also communicated in the press release that went out last week. We've also communicated via television, newspaper, and other media on how to, what the requirements are so that people could pass the information along and be able to respond and complete the online application. The whole process is online. The application, all of the certifications, and then the checks will be distributed via the ACH to individuals' bank accounts. And so we go through all of that process, and then we have, again, our helpline to be able to help guide people through. People who have received Paycheck Protection or Economic Injury Disaster loans, Paycheck Protection program generally ran out earlier in the year, and so any recent expenses that people have related to that, they can apply and submit for those. And then that's, I think this is pretty much it. I think, is there another slide, Chris? Okay. And this just kind of summarizes the some of the requirements. As you know, because it is the federal government, and we learned this from the Small Business Relief Program, that there's a lot of compliance work that's required. And so we try to anticipate all of that and include that in this process so that it can make it easier for the restaurants and businesses to apply. And then they have to retain a number of items in case there's a subsequent audit. So the application period started this morning. It goes through the end of Monday, December 7th, or earlier if grants are depleted. However, we anticipate that we'll be getting hundreds of applications this week. And I believe that, okay, one more. And so, again, we have the hotline, 615-1777, for people who have questions. But this gives you again, a summary of the flow. And again, I just want to really highlight that this is a Herculean effort to be able to turn this around in this 4 to 5 weeks to get these checks distributed, this money distributed through ACH. And so, but what it does is sets up a nice structure for, again, subsequent receipt of federal CARES money and to be able to distribute to qualifying businesses, restaurants, and others. All right, and I think that is it. Okay, there we go. All right, thank you, Chris, for doing the slides. All right, so I'm ready for questions now. I know that there were some over the weekend, and I tried to address some of those. I know that I'm playing tag with 1 or 2 council members. We've been calling each other back and forth. and haven't connected yet. But again, everybody does have my number. They know how to catch me. And so we'll make sure that we do connect. But questions that you have right now?
Thank you. Does anyone have any questions?
Sure do.
I knew you would, Councilwoman Days. The floor is yours.
I'm working hard on behalf of the first. Please know that. Thank you, Rodney, for that. And I want you to know that I do appreciate your earlier work with that small business. I mean, that just was kind of not put together well or whatever. But, once you picked it up, it seemed to go a lot smoother because I think people were looking for some kind of assistance that they were not getting. And so that's the first question I wanted to ask you about this program. Are you providing any kind of technical assistance with this?
Yes, and because of the short timeline, it's primarily our staff that have refocused and pivoted to focus on this for the next 4 to 5 weeks. But we've been working very well with the county departments, including legal, accounting, the programming departments, to make sure that we anticipated whatever needs to be done up front, so it can make the process much smoother. So we do appreciate that partnership with the county departments.
The other thing too is, I know you probably want to hear this, but I've already had calls this morning that some of my businesses could not get through. And I don't know if the system is down. I'm not sure, but they were not able to get through this morning. And this is the first day of that. So you might just kind of want to check that to make sure that that is the case. So this distribution is wholly within your department in terms of deciding if the criteria has been met and all those other things that surround the implementation of this program. That is all within the partnership.
So we are serving as the implementation arm for this grant program. And so we've talked through with the county departments all of the requirements for this program to make sure we're in compliance. We're like a sub-recipient to the county, to the federal government. So we want to make sure everything flows back the way to the federal government in a way that it will be accepted properly. And so with that, we've anticipated all the compliance requirements and all of those things to make sure that it does do that.
You have done that. That's great.
But we will be executing what we've agreed on.
Okay. Now, this 615-1777, is that a direct number to this program?
That's a hotline number to the program. But you can imagine that's why we can also direct people to our website, because they can go right into the application and start filling it out. And so you can imagine during that first couple of hours, we just had a ton of calls. People would say that I just did 5 calls and 20 are on the line. So they're going to get to them. But we do recommend that people go ahead and get into the application and start filling it out.
Well, I certainly appreciate that, and know that since the people who didn't get it before can't get this, hopefully we can spread a little of this, even though it won't be $15,000, but it will be something that will help some of these businesses to stay afloat. I've had many of mine to go under because they couldn't get the initial money. So I appreciate that, and thank you very much, Madam Chair.
Oh, you're very welcome.
Thank you, Councilwoman Days. Are there any other questions from council members?
I have a quick question.
Yeah.
Are morticians or funeral home directors, I didn't see that lit on the people ineligible. Are they eligible?
Councilwoman, we didn't have them specifically. We tried to identify as many as we could think about that would be eligible. They should call, and then my team will look at what that situation is. But we're trying to get, identify businesses that had some employees that weren't, that were, you get the tone of it by looking at
I understand
right.
I just didn't see them listed. And also with the compliance piece from the last, are or from the original SBR plan. Some people who are sole proprietors had complications with providing information because they were sole proprietors. Do you have a I don't know, process or someone they can talk to about how to handle the compliance piece?
Yeah, so we're generally looking for businesses that have, W-2 employees, so they have employees. And so, again, because of the shortness of time, we couldn't make a program that worked for completely everybody. So we're hoping that if we get subsequent dollars, we can do individuals that we weren't able to provide service for this time.
Okay, thank you.
You're welcome.
Any other questions from council members? Okay. Do any members of the committee or the council have questions regarding the whole presentation today or any follow-ups that have come to mind? Okay. And I believe, Diane, that you said we do not have any public comments.
That is correct.
Okay.
Yes, ma'am.
Well, I think that this brings us to the end of our agenda. Would anyone like to make a motion to adjourn?
So moved.
Can I have a second?
Second.
All in favor?
Aye.
All right. Thank you all so much. That adjourns. Appreciate all of you coming and presenting on your buckets today. Thank you.
Thank you.
Thank you.